Hey guys, today we're going to be talking about the conduction system and some concepts that you have to know if you're trying to learn about the heart. The first thing you got to know is, where does this all begin? We're looking at something called automaticity, where your heart actually creates its own electrical impulses. Now, where does that electrical impulse start? In what's known as the pacemaker, or the primary pacemaker of the heart, the SA node. Okay? Understand the SA node stands for sinoatrial node, and that SA node, when it fires or depolarizes, it causes atrial contraction. So the top of the heart, where blood flow goes from the top of the heart down into the ventricles. Now, the first thing I want you to know about this SA node is when we're looking at an EKG, it creates something called a P wave. Okay, a P wave should always be upright and round. Upright and round. Okay. Next, once that electrical impulse fires and it contracts the atrium, it goes to my next node called the AV node, atrial ventricular node. Here in this AV node is where there's a delay or a pause. Why do you think that pause is occurring? Well, to allow for the ventricles to fill with blood. If there was no pause, blood would just be shooting from the SA, or the top of the heart, down into the ventricles, and there would be no time to allow for it to fill. So there has to be a pause. This AV node is seen from the start of my P wave to the end of this break, to the start of my what's known as a QRS complex, which we're going to talk about now. So the beginning of this Q wave, this is what's known as my PRI. Now a PRI, or a PR interval, PRI equals 0.12 to 0.20 seconds. Please write that down. Make sure you know how long your PRI interval has to be. Remember, this is how much time it takes for those ventricles to fill with blood. Next, that electrical impulse fires down and is going to go to either the right or left, actually both, of what's called the bundle of His, and it goes into our bundle branches. And this is where electrical firing is occurring of the ventricles. Once there's a depolarization of the ventricles, this is going to push all that blood out of the heart into systemic circulation through the aorta. Now, when I see that on an EKG, I see something called a QRS. QRS stands for ventricular depolarization. Ventricular depolarization, which looks like this. Okay, so again, we have our P, our PRI, and then our QRS. Now, again, QRS just stands for ventricular depolarization, and it must be less than 0.12 seconds. So I know in your textbook you might see something that says it must be less than 0.11, but it includes 0.11. So let's say that our seconds is 0.11. This is considered normal. That is a normal QRS complex in width or duration. Anything greater than 0.11 is considered wide and complex. Okay, so you got to know how to read your EKG paperwork. Now, after our QRS complex, I always try to think of it, or I explain it like a battery. How do batteries work once they empty their charge? Well, they have to recharge. And what's the recharge on your heart's batteries? It's called repolarization. So the ventricles go under something called repolarization, known as a T wave. Okay? T wave is going to occur after that QRS complex. So if I drew a QRS complex, a T wave is non-symmetrical. One side is always a little bit differently shaped than the other side, and it should be less than the half overall height of my QRS complex for it to be considered normal. This allows for the ventricles to refill. It allows the ventricles to repolarize and allows those ventricles to be able to fire again. And then it's just a cycle that goes on and on and on for the rest of your life. P wave, have a PRI, allows for those ventricles to fill with blood. Our ventricles actually contract, causing what's known as a QRS complex. Then those ventricles have to repolarize. That's when we see the T wave, and then it starts all over again. And I'll draw a quick example of one. Back to my P wave, QRS, T wave. And it does this over and over and over again.